Welcome to Global Morning, and of course, thank you so much, Ogochukwu Mobuna, for that brief on social media buzz. Now, of course, throughout this week is Breastfeeding Week, like we and I mentioned, and Breastfeeding Week 2025 focuses on driving nutritional investment in mothers. Now, the theme highlights the crucial role of the adequate maternal nutrition in successful breastfeeding and subsequently optimal infant health. It emphasizes the need for policies and support systems that provide mothers with the resources they need to breastfeed effectively, including access to nutritious foods, healthcare, and supportive environment. Now, the week aims to raise awareness about the importance of maternal nutrition, advocate for increased investment in maternal health, and promote breastfeeding as a cornerstone of infant and maternal well-being. Today, I am being joined by a very good friend of mine. She is Dr. Love Okafor. She's a consultant, obstetrician, and of course a gynecologist at the Limi Hospital's Abuja Central area. Thank you so much for being a part of the program.
Thank you,
Dr. Okafor. Now, talking about this particular theme. Now, what is the primary purpose of breastfeeding? Why should we breastfeed? Again?
Breastfeeding is the purpose of breastfeeding cannot be overemphasized. It's a total nutritional package,
Okay.
For the baby, and of course, definitely has its benefits for the mother. So it's something as a gynecologist and obstetrician, we encourage women to go into breastfeeding fully, especially for the benefits of the nutrition for the baby. A healthy baby and a happy mother and family is the ultimate for every mother. So that is what we wish that every mother would imbibe and embrace. Breastfeeding is very, very important. It has everything in it that the baby needs.
Really?
For the first 6 months.
Oh.
Yes, including water. There's water in it. So go on for exclusively breastfeeding your child for the first 6 months. You don't need to add any other thing. It's
Really?
all encompassing. Yeah. Very.
So for mothers that want to go overboard, I want to breastfeed for as long as 1 year, some 2 years, which I wonder how they cope with that. But how effective is that? Will it develop the brain of the child more, or you just want to breastfeed for 2 years?
No, it has a lot. It prevents childhood illnesses.
Really?
Yes, including diarrhea diseases. It prevents asthma, even allergies.
Wow.
There's so many benefits. So we encourage women to breastfeed exclusively for 6 months and extend it to as much as 2 years and even beyond if you can. Yes.
Okay.
Are you surprised?
Exactly.
Very possible.
Okay, 2 years, 3 years. Really?
Yeah.
Now, of course, you mentioned the benefits when it has to do with the children, prevents diarrhea and all of these diseases around. So, what's the benefit for the mother? She's giving so much. What's her benefit?
The breastfeeding helps the mother to bond with the child.
Oh.
This thing they say, a mother can tell her child better. It starts from breastfeeding. You bond. In fact, we encourage the mother to start breastfeeding as early as within 30 minutes of childbirth. Not only the bonding, it also helps the womb to contract, to get back to the normal shape and go back to the sweet 16 that you are.
Really?
Yes.
Women, are you listening?
It also helps to prevent excessive blood loss after delivery.
Oh.
Yeah, breastfeeding releases, when a baby suckles on the breast, it releases this hormone we call oxytocin, which helps the womb to hold itself together. And, by doing that, the mother does not lose so much blood after delivery. So that's why we encourage breastfeeding, especially on the side of the mother. Very beneficial. Your womb goes back to normal, and you don't lose so much blood after delivery.
Really?
Yeah.
But for mothers who, I've seen some mothers who tell you, oh my goodness, she just gave birth and she cannot lactate, and then she has to bring in formula. Does it affect the child in any way? Or when she starts lactating, she can continue, stop the baby food and all of that and continue, and everything still goes back to normal?
Okay, I will use an example with a woman that delivers by cesarean section.
Okay.
Okay, you can agree with me, the woman may not have enough strength. She's maybe still in a little bit of pain and cannot put the baby at breast immediately. What do we do? Do we starve the baby? No. We use the formula to keep the baby going until the mother can put the child to breast. And when she is ready for that, she can now drop the formula and go back to exclusive breastfeeding. That still counts for exclusive breastfeeding. So we don't allow the child to starve because, do you understand?
Yes.
Because the mother cannot, initiate breastfeeding immediately. So we use the formula to keep the baby going until the mother can, start breastfeeding on her own.
And it doesn't affect the baby in any way?
No, it doesn't. It's just for a few hours. Okay, or maybe a few days. Like if it's a first time mom. Most time myself, my breast milk started flowing on the second day of delivery.
Really?
Yeah. So once my breast milk started flowing, I put my baby to breast immediately and we continued. And it was still an exclusive breastfeeding, and I did that for complete 6 months.
Really?
Yeah.
How about some kids who do not like breast milk? There are some that will. I know a lot would at 4 months they're done. They want the formula or all of that. Is there any health hazards attached to all of that?
No, there isn't any health hazard attached to. You wouldn't allow a child to starve because he's not latching.
Exactly.
For some reason, maybe the mother has some disease like mastitis or breast abscess, whereby a child is suckling the breast and it's not tasting very well. You understand? So with that, you can't allow your child to starve. You get to the hospital, get yourself treated, and then you can go back. But peradventure, you can't go back to breastfeeding. Of course, you continue with the formula. The formulas are good in itself. We are not ruling them out completely, but breastfeeding is the best.
Strictly breastfeeding.
Strictly breastfeeding for the first 3 months. But there are situations where a woman cannot breastfeed, then we make do with the formula.
Okay.
Yeah.
Now for women out there who want to balance the two, because some will say the breast milk doesn't actually fill up the child. So even if you breastfeed, you still you need a support system like the formula to help keep the baby full. Is it right, or is just a myth?
No, it's not a myth. Of course, I've seen women coming back 1 week after delivery, 2 weeks after delivery to say, "Doctor, this child is too much. He just continues to cry and cry and cry. What do I do?" Do you understand? But I would like to address it this way. Some women, they are not patient with the child to breastfeed on their own, to suckle on the breast. It's work to suckle on the breast. If you notice, when a child is suckling, you see some sweating on the face. It's energy. Remember, the cheek will continue to do like it's work on the child. So some women, they are in a hurry to let the child get filled up and then go back to doing something. That's why we give maternity leave. It's full-time job to breastfeed.
Oh, that's the reason behind maternity leave.
Yes.
Okay.
You want to dedicate that time to
the
breastfeeding.
child.
Don't use it for another thing. It's for the child.
A woman has a
So
lot
you
going.
be patient. Position yourself. There are ways you sit. Bring the baby to the breast. Don't hunch your back to. When you do it the wrong way, you get tired. You have body pains, and you just say, "I beg, give me that formula. Let me give the child." Yeah. But if you're patient and understand how to breastfeed, the right positioning, the way you should sit, how you position the baby, you will see that. First, breastfeeding was the best part of my, the time.
It's so easy.
Yes. Especially when you're at home, you don't have to bother yourself about anything.
Boiling the water, doing all of that.
You don't have to. It's easy. And, I thank God. I don't know how he does it. It's in the right temperature. You don't need to warm it up. You don't need, do you understand? It's just the right way the baby wants it. So that is what you do, and you can, be patient with the child. Make yourself comfortable when you're breastfeeding. And I can tell you, it will be enough for the child. But when you don't do it the right way, you're tired, your body is not smiling at all, and you find an easy way out by supplementing with other feed. Of course, there are other things again. If a woman is not properly fed, have you tasted the breast milk before? I will encourage some people, women, taste the breast. It has a taste. It's just like food. When I serve you good meal, you will know. If you serve the one that is not good, it's same thing. So for you to also serve the baby a rich breast milk, you have to eat very well yourself. Feed well. The breast milk get quality. Yes, is what you take that you give out. Okay, if you don't eat well, your own does not taste well. Children, they know what is good.
They do.
They do. So when you is not tasting well, sometimes they will fight
I
it.
don't want it.
And you know, especially when they have tasted that supplementary feed, and you will I see them refusing this, looking for that one.
Exactly.
Okay, and again, another thing that makes them not to, the feeding bottle is faster. Remember, it has an opening on the teeth.
Yes.
So sometimes, like when you're hungry, they give you feeding, but you gulp it down faster. So when we call it nipple confusion when a child feeds more on the feeding bottle. So women feel like breastfeeding would prefer you to feed directly from the breast.
Okay.
I'm not, some women will say I'm exclusively breastfeeding, but they still express it and put it in
in
the
the
feeding bottle.
Exactly.
No. If you do that, the child will be confused. They will prefer to feed on the bottle. The way they gulp it down is less job, for them. Yeah, it's less job. But the feed from the breast milk, they take time and suckle and rest. Suckle and rest.
But you know what, Dr. Love? I think some women, when you go for antenatal, they explain to you that you must position yourself in a way that the baby can actually suck easily and be full on time. I think some mothers, especially new moms, they do not know how to position their hands or the baby, their back, and all that. Can you just give a small demo on how you can just position yourself?
What I tell men is you get a very comfortable seat with a backrest.
Okay.
You understand? So you rest your back. The bum of the baby should be on your palm.
Okay.
And the head here.
Okay.
I wish I had a demo.
Yeah,
the bum where you carry your baby like this. And I said before, the baby to the breast, not the breast to the baby.
Oh.
You may have to get a stool to support your leg, or you cross your leg, or there are other pillows that we use that we can use to support your arm, so that you don't get tired or the baby doesn't weigh too much on you. Okay, so that is how you do it with a pillow. There's a breastfeeding pillow. It's curved somehow where you rest your hand. Then remember, assuming this is the baby, this is the bum, carry the baby like this. It's easy.
It's easier.
Easy. Carry, and the head, you support it on your arm. You understand?
Yes.
And then bring the baby to yourself. Remember, don't hunch over. Your back will hurt.
And you make your breast sag too.
Yeah, so you bring the baby towards you. Remember, there's a way, the nipple. Baby is supposed to latch on the areola. Areola is the black, that black part.
Yes.
Not just the nipple. If you give the baby just the tip of your nipple, he may chew on it or and crack it. So the lips of the baby should be round your areola. Remember, there are ducts in the areola. So when the baby latches on it, it will also help the milk to come. Other times, there are times women, don't leave the breast for the baby. It will weigh on the baby.
It can even suffocate.
Yeah, so somehow we use our hands. Somehow there's a way we put it, like a scissors. Put it like this. Somehow trying to allow the baby the space too. And at the same time, these hands also help to press on the ducts. There are ducts behind that areola. That is where the milk is deposited. And then you somehow press it, and also helps to drive the milk to the baby.
Very important.
Another thing we also tell women, when you are breastfeeding, breastfeed on one breast per meal.
Okay.
By that I mean, in one feeding time, feed on one breast before you go to the other. The breast milk, there is what we call fore milk and the hind milk. Like, for instance, a milk is settled, you put a milk in a jar. Somehow the main cocoa settles down.
Exactly.
And the other one that is like water comes up.
Yes.
So if you feed a few minutes on this, and then rush back to this, your baby is just feeding on the fore milk. The concentrated one is still behind. So you have to feed until the baby takes the fore and the hind milk. Make sure he feeds on everything that has been produced here in all its totality. So,
But how do you know? Like, how do you know? Because someone says, like a doctor says, the child feeds more on the left breast than on the right breast. I don't know how true that is.
No.
But at the same time, but the truth is, I think when you feed on the first, like the right breast,
Yes.
and it's almost empty, you will know as
Yes,
a mom.
you
Then
know.
you quickly shift over
Yes,
to
yes.
Oh.
But by that time it's empty. The hind milk is also emptied as well.
okay.
And you feel the emptiness. You would.
Wow.
Yeah. And so by that time, most time the baby is filled up. So you now wait for the other time to feed. When it's next time to feed, there, don't say this milk somehow. Or some for some people, one breast flows more than the other.
They said the left breast.
I don't know. I'm not
So sad.
which
It is a myth.
but one always flows more than. But it's not the reason why you should just be feeding on that. Remember, if you face that one, somehow that one gets bigger than the other.
Women, I'm telling you, and it's so painful. I want to be humble.
So somehow be intentional. Please just decide that after this is this one, regardless of the size or the volume that is produced. You understand? So you just go turn by turn on this one, and the next meal you go for the other.
Yeah, very important. And then giving that child that healthy. Do you know what? I really need to laugh on this. Let's quickly go on a very quick break. We'll continue shortly. Stay tuned. What? That thing. All right, you are welcome back to the first discuss on Global Morning this beautiful Tuesday morning, talking about breastfeeding week. And like I mentioned, I am not doing it alone. I have Dr. Love or Kafo here with me on the program. Of course, she's an obstetrician and a gynecologist at Limi Hospital here in Abuja. All right, Dr. Love, talking about breastfeeding, a woman, how can she on her own give the best when it comes to breast milk to the child, so there will not be any lapses and all of that? What is she supposed to do to give back constantly?
Okay, first of all, you have to be intentional. Have to decide that I want to exclusively breastfeed. It's decision. Just like when you are determined, you set a target for yourself and you say, I'm going to achieve this. It's same with breastfeeding. Set a target that I want to do this. 6 months, I want to exclusively breastfeed my child. And you see it's doable, it's possible. Then when you have made that decision, you plan for it. You know, like I said, input and output, they are same. You have to dedicate time for breastfeeding. It's not the time you start traveling and, you know, some women, they give the maternity leave, you want to go to your feed. No. It's for baby, it's for that child. So you dedicate time to breastfeeding. Don't be in a hurry for the child to get off your breast so that you go and do it. No. then you must feed very well.
Very important.
Breastfeeding is a product of conscious effort, intentional plans made. So the quality you produce is dependent on the things you have eaten. That's why I say taste breast milk. I've seen many. It's flowing, but the quality is not nutritious.
And you will know when the quality is not right.
Yes, the color, the
exactly,
thickness.
Yeah, that's
very
true.
important. So you plan. So that's what we also encourage our men. Plan with the woman. You give her money. Buy things. The Igbo people will call it omugo.
Yes, that's
what it is. Planned. Your mother will come. It's not time to stress her. If you stress her, she wouldn't produce enough milk.
That's true.
So she needs help. Someone to help with the baby so that she can have enough sleep when she needs to have sleep. Someone to help even make the meal for her.
Yeah.
Because she may just be, these babies, they stay 1 hour on breast, It's work.
Yes,
so
it is.
she may not even have time to even cook. So you have to help her with cooking, with cleaning, so that she would dedicate that time to breastfeeding.
Very important.
And then feed her well.
Very important.
That, the people, like, you see some people that are not very well to do, they do exclusive breastfeeding more than the elite. But you see their children, they don't look very healthy. Why? Because she's not eating enough.
That's true.
They don't even have money to buy the formula. So they are the ones that do exclusive breastfeeding pass now. They feel, even some, if you need them, they'll go even exclusively breastfeed for 1 year. But because with time the nutrition and everything content
diminish, of course.
So they do the exclusive breastfeeding 6 months. You don't even need to beg them like you beg the,
because that's the way forward, really.
Yeah, but you see, the babies are not even looking very healthy because she's not feeding well.
Yeah, that's
so
true.
the woman needs to feed well. It is what you eat that you give out to
You
your
know what, Dr. Love, in situations like this, someone will say, Dr. Love, I know you're saying all of these things, feed well with this harsh economy. Please get your vegetables.
You don't need to break
What are you saying? Don't break the bank.
When we say feed well, you just balance it. It's rainy season now. Vegetables, you can plant some around your garden.
I'm telling you, make so much
green vegetables. That's all.
And make your eba or your semovita eat and be happy.
Yes, really. You don't need to break bank.
You don't need to break the bank.
Things around you.
Exactly. Just make it in excess and then eat as much. You don't have to have just make it in excess and just eat as much. You don't need to break the bank. So it's for every. You heard what she said. Lots of water. So you don't need to say it's for the elite and all of that. They can eat, they can afford this. No, with your little you can afford it and do so much for yourself. Now let's shift a bit and talk about hygiene when it comes to breastfeeding. Most women, when they go to the hospital, they say, I'm doing the exclusive breastfeeding, I've not done anything, but yet my child is stooling and all of that. What is going on? What is she doing wrong?
What I think she may be doing wrong, like I mentioned before, where a woman, you feed the child only breast milk, but you express it and put it in feeding bottle.
Exactly.
Remember, you can't be 100% clean with all the you clean your. Can't. Remember, feeding bottle also they have crevices.
Exactly.
Do you understand? Even your hand can also contaminate the teeth of the feeding bottle. Maybe touching your body. Sometimes it will enter one place. See some women use it and clean. Yes. So those are I'm sorry. Those are the ways you can contaminate it. You are feeding breast milk, but the medium you are feeding it through, it's not clean enough.
And just to add to what you've said, sometimes your inner clothing, your underwear is not well washed, and then some women immediately they breastfeed. Some women just early in the mornings, you don't go take your bath, clean yourself, like seriously.
They wash bra.
Really?
Remember, sometimes the breast milk will spill into
and it has a bad smell.
Yes, and they wear it 2 days, 3 days before they clean up. So those are the ways a child can, gets diarrhea.
Exactly,
From,
exactly. Oh my goodness, Dr. Love, I wish we had more time. We had more time to talk more on this. Now, one more question. Now, how does breastfeeding promote a strong bond between the mother? I really want you to emphasize that, because it's very important that we know how it just brings the child and the mother together. You know, when the child is breastfeeding, he looks into the mother's eyes or something to know the mom, the voice, and all of that.
You know that story in the Bible where I can't remember where, you know, you are from, you know, I think was it Moses or what was picked up when Pharaoh
yes,
and there was a nanny he had that was constantly telling him that breastfeeding is everything. In fact, my child that I'm closest to is the one that I breastfed longest. Yes, the bond, I don't know how to explain it. It's the one I breastfed longest. You talk, you communicate. Remember, there's a time a baby will bite your nipple and you'll be like, they know you.
Exactly.
You talk to them, you communicate, you know, and I will be like, boy, you are biting mommy. You see, sometimes they laugh and giggle.
Exactly.
They know you teach. That is the bonding. You teach them values, things. They read your face.
Yes, they do.
They do, and know when you're happy, when you sometimes you did not spank the child and he's crying because mommy has put a face somehow. So it's the bond. I don't know how to explain it.
You know,
I don't know how to, but it's so powerful.
Yes, it is.
It unites the family.
Yes, it does.
You see, sometimes you see the father will just be envying the bond between the mother and child.
But you know, Dr. Love, it's you know, there's a way, and then the thing about all of this, despite the mother breastfeeding and all of that, the child still says daddy first.
Yes.
He still says
yes.
daddy
I don't know
first.
whether that the consonant it was easy to pronounce, but even the child knows a father that is present.
Exactly.
He knows a father. When you are supporting your wife,
an intentional dad.
Yes, an intentional. You're always around when the baby feeds. You sometimes you like, mommy, come and feed your baby. Your baby is hungry. The child knows.
Yes, he does.
He feels it. It's not. We can't touch it, but it's something we feel. And everybody around the father, the mother, everybody is happy about it. And this is product of exclusive breastfeeding.
Yes,
you can't stay indoors with somebody 6 months and the person is not bonded with you. It doesn't happen.
It doesn't
happen.
Thank you so much, Dr. Love Okafo, for this. We're going to throw more light. So, individuals out there, you have to stay glued to Global Television, because on Health Guide, we're going to throw a lot of emphasis on issues, especially when it has to do with the areola, when the child sucks so much and then there's so much injury around the breast. What does the mother do? I know a lot of new moms and moms who are breastfeeding go through this sort of issue. But at the same time, we're going to delve into it in the course of Health Guide on Thursday, by the grace of God. And like I mentioned before, I am being joined by an amazing friend of mine, Dr. Love Okafo. She is a consultant obstetrician and a gynecologist at the Limi hospitals right here in Abuja Central area. Yeah. Thank you so much, darling, for being a part of the program. And please,
it's my pleasure.
Women out there, say something to a woman that is breastfeeding or a new mom. Just look at that camera and say something to her.
Okay, what I have to tell you is that is very profitable to you, to the baby, to the family, and to the society at large. A well breastfed baby is a healthy baby and is a product of the society. So we encourage all of you to do exclusive breastfeeding. If you have any confusion at all, come to me. I'm at the Limi Hospitals, Abuja. We are baby-friendly hospital. I'm very accessible, and I can also put you through if there are any confusion.
Thank you so much, Dr. Love. And at this point, we have to wrap it up on the first discuss of the day on Global Morning. Hope you had an amazing time with us today. And remember, it is Breastfeeding Week throughout this week. Yes, that is what it is. And driving nutritional investment in mothers. Women are key, amazing.